Do you have a brilliant startup idea but are stuck in the launching phase? Are you feeling overwhelmed by funding, marketing, or just where to start? Don't let your startup idea stay grounded. Visit our website at eapla.com to schedule a Blue Couch meeting and launch your startup journey today.
Matt, another episode of On the Cusp. Welcome back.
Ready.
And today we've got Heidi Cram with Apotheworx.
That's correct.
So Heidi, what is Apotheworx?
So Apotheworx is a concierge pharmacy, also just an independent pharmacy as well. We offer membership options as an option to kind of lower your prescription prices even more and offer a little bit more elevated level of service. But at the end of the day, we are just an independent pharmacy, locally owned and operated by myself.
Okay, cool. So, quick questions. I'm just going to fire at you first. Yeah. So, do you still take insurance?
So, no, we do not. So, that's probably the biggest difference between...
So, it's fully paid. So
yes. So, we do not bill any insurance. You can always file insurance on your own, so we can give you all that paperwork.
Gotcha.
So, if it is something that's a little pricier that you still want to get with us, we can fill anything that you're willing to pay for. And then you can always go file it.
So what are you doing?
Okay.
So the business model is you're concierge. I go to you. I say, I really want this, but I buy a membership.
Okay. Yep.
Okay. Which is really the basis of the concierge piece.
Correct.
Of that.
So for our concierge members, we do not charge any markup on the medication. So you pay a monthly fee.
Right.
$65 a month for an individual, $100 for a family. And that includes pets. We can do pet meds.
Really?
So $100 a month for a family, and that, if you're a member, we do not mark up your meds. So basically, you pay what we pay from our wholesaler, which is a local wholesaler.
For the drug. So
Yes.
the only thing you're really paying for is you're paying the cost and your membership.
Correct.
For that.
Which a lot of patients are finding, it's a little hard sell because, right, everybody thinks everything's cheaper on my insurance. You know, and,
That is not the truth.
Sometimes it is, and there are certainly pricier medications that, you know, if you can get it covered on your insurance, it's going to be cheaper for you. But most, especially generics, really are not.
That's awesome.
So
yeah, the concierge thing, I mean, it's taking over.
Yeah.
medicine.
So-
I cannot tell you how many physicians and people in the healthcare industry, both therapy, I mean, the full range
All of the
healthcare
professionals.
are trying to figure out a way to provide better service
Yes.
for people.
People
It is a big
want
trend.
customer service.
That's right.
And going to the doctor has not felt very customer
Or
service.
the pharmacy.
Or the pharmacy.
It's terrible.
Oh my
Yeah.
gosh.
I've been
We
using
have
the
two
same.
diabetic children.
Okay.
And like going to the pharmacy
Yeah.
and getting insulin
Yeah.
and getting Dexcom, all that is like
Yeah.
a constant
I mean,
struggle.
I have one of our members is like, so we have different kinds of members. We have some that are looking to save money for our plan, you know, then we have others who are just don't care and just don't want to deal with
Right.
the hassle.
Right.
And she's like, I literally would get a pit in my stomach every month when I'd have to pick up my medicine. It just made me physically ill because I just never knew if they were going to have it,
My
how much it was
wife
going to be.
chasing around insulin for kids and stuff is a crazy like situation.
Yes.
It's a thing.
But
So-
you want the same, you want to deal, I mean, what people are really looking for is they want to deal with an individual.
Yes.
Is what
Yeah.
they want.
And that's
when
what I
you're-
wanted to provide. I mean, ultimately,
Yeah.
I mean, you know, if I can save people money too in the process, that's even better.
Right.
But ultimately, what I really wanted to be able to offer my patients was my services.
Right.
Yeah.
I mean, that's amazing. I mean, yeah. And
So
just the
the-
accountability of being able to call you and being like,
Yes.
are you going to be able to get my medicine?
Yes. So
Right.
our members have 24/7 access to myself or my staff, my technician. So most of those questions like, do you have this, do you have that, he can answer. If it's more of a clinical issue, I, of course, will step in and answer those questions. But they have, you know, we have an app that you can reach us all the time, and my patients do. They don't abuse it, but it, you know, sometimes 10 o'clock at night, they're like, oh, I need this first thing. Can you do that?
Right.
Absolutely.
That's great.
So
that is really.
And then also free delivery for our
So
members.
obviously,
Okay, cool, yeah.
you know, as a pharmacist, you've probably worked in multiple different, you know, everything from hospital to the actual, you know, pharmacies. What really got you thinking about this? Because this is a little different.
Yeah,
It's a different
very
business
different.
model.
There's not very many of these in the country, much less Louisiana, much less Shreveport. So.
Oh, cool.
Yeah, no, it's a pretty new. I tell people I'm either brilliant or stupid. I'm not really sure which, but we're trying it.
A real entrepreneur. That's where you are.
Yeah.
That's the best.
So, yeah, you're right. So I graduated in 2003 from pharmacy school at ULM. I started at Northeast, and when I graduated, it was ULM. So I'm a little bit of both. So yeah, 21 years as a pharmacist. I've worked in the hospital. I did a residency in New Orleans at Ochsner. Went to New England. My husband's from Maine. We spent a few years up there. I did some retail work up there, and then ultimately moved back here. I'm from Shreveport. We moved back here in 2007 to settle and raise our family here, and been working in chains that whole time. And I love retail. I did a residency thinking I wanted to do more hospital clinical work, and I didn't love it. I liked being out with the patients and out with the public more, and being able to, give people the information they want instead of just in the hospital in the basement working. Not hospital pharmacists do an amazing, hard job, and it just wasn't for me. I like being out with the people.
Yeah.
So I hightailed it back to retail after that, and love it. I've always loved my retail job, and I grew up. You'd asked me earlier. My dad's was a pharmacist. He passed away, but he was a pharmacist. So I grew up in independent pharmacies in Shreveport.
Oh, cool.
He worked for a number of them. So I grew up doing my homework in the back office, and seeing those interactions as a kid with him, and it just felt natural for me to
Shreveport
go
had
that
some
route.
great, locally owned
Yes.
pharmacies.
Yes, so many.
And that kind of has been, that customer service has kind of been lost. That's cool that you're kind of bringing us to
the chain pharmacies
next level.
changed that business
Yeah, it
quite
changed.
a bit.
90s, early 2000s, they
Right.
kind of started taking over the pharmacy world, and they can offer a lot of things, but there's a lot of things they just can't offer.
So, I mean,
Right.
from the business standpoint, obviously you saw a need, you came up, you had an idea,
So-
you went down there. Talk about the challenges that you really faced starting.
A couple of years ago, the chain I worked for transitioned and was acquired by another chain, and I decided that I didn't really want to stick it out with that long term. So I was thinking about I still have a pretty good bit of years left in my career, so I was trying to figure out what do I want to do with the last half of my career. And my husband's a business owner too, and we're kind of just entrepreneurial by nature, and we love Shreveport. We've invested a lot in Shreveport, and so I just was like, I want to do something that's meaningful. I have 4 children. If I'm going to be at a job away from my family, I want it to be meaningful for my community and for my children to kind of witness and see, kind of like I did. And so something for the community. Independent pharmacy, of course, was the natural progression, like I'll just open my own pharmacy. But the challenges with opening independent pharmacies and just filling prescriptions, like you would imagine, it's very challenging marketplace because of insurance companies largely, and the reimbursement rates. And I'm sure you've heard a lot of the drama this week about CVS, PBM drama. I don't know if y'all have or not, but so that all is very, that's real, I mean,
I even think the governor issued a proclamation yesterday.
Yes, okay. That's a big deal. So anyway, the PBMs have kind of, while maybe their intention was good in the beginning and they're needed, it's caused a lot of challenges, especially for independent pharmacies. It's pushed a lot of them to close their doors, unfortunately. So being able to really make a good, solid living as an independent pharmacy owner, it's tough. It's really hard. So I was like, I don't know. And so you have to you're always looking for alternate revenue streams as an independent pharmacy owner, whether it's compounding or whether it's specialty or, things. Just being able to fill prescriptions and bill people's insurance and get reimbursed adequately is hard.
So as you're building this business from nothing, I would think it would be very difficult to get the product and have enough of the random, because it had to be random.
And that's another
needed.
issue with third parties is cash flow in a pharmacy, because you have to buy them and then they just sit on your shelf.
Right.
But honestly, most of them they're very inexpensive.
Okay.
And I have chosen a local wholesaler distributor, Morrison-Dixon.
Oh, yeah.
So I can get a lot of things the same day because I can just run up there. Not everybody has that luxury to have a wholesaler in their town like we do. And they're a great company, and they've been really wonderful to work with. So I don't have to stock everything because I can still usually get it the same day.
Cool. That is
And then
cool.
once I get it once, then I've got it.
Yeah, but if somebody calls you and say, hey, I really want an alternate solution for this drug, can you get it? They call you. and you say, yeah, we can do this, and this is your price, and with the membership.
Yeah.
And now, where are you? Where is the pharmacy?
Okay, so we are at 429 Crockett Street. So we're downtown, which is also important. We've got other properties downtown. We've invested in downtown. We think that's the heart of the city and trying to revitalize that and bring it back. But also just because I didn't want to put myself in one part of town and kind of under the illusion that, oh, I'm serving this area or this area. And so I felt like downtown was just a good centralized, since we do deliver, we're accessible to Shreveport and Bossier and all of our surrounding areas, and everybody kind of knows how to get to us.
Yeah, and cool. Well, the truth is in Shreveport, Bossier, you can be anywhere you want to be.
Right.
Okay.
Yeah, it's a good place to run delivery.
It is. Okay. I mean, there is no traffic. People complain about traffic here. Of course,
not at all.
was in Washington, D.C. for 6 years. Okay, I know traffic.
Right.
All right.
No, we have great
We
here.
don't have traffic.
No.
Yeah.
So anyway, so yes, we're downtown. Very easy. We have curbside. We have a spot right in front of our door. Easy in and out. We can bring it out to you. You can come in. We designed it so that I was also very intentional with my design about wanting it to feel like almost spa-like and very relaxing. Because
cool.
people tend to, be stressed when they're in that.
I'm sure your design is pretty cool, knowing your husband.
So I have a little in there, but that was important to me and to him. But
that's interesting. I mean, because a lot of people would tell you, "Oh, don't go downtown." What made you pick downtown?
Well, like I said, we have invested in downtown. We own some properties down there, so it kind of was a natural fit. But also, from my perspective, I think part of the problem with people's have a perception of downtown, and it's not the most accurate probably.
Right.
And so if you don't have to come downtown or you don't already have business downtown, then you don't know. It's just your perception. So I wanted to get people downtown that maybe wouldn't ordinarily come downtown.
Right.
So they don't work there.
I mean, you are so right.
There.
I mean, I even heard Mayor Arsenault say this week, we're hard on ourselves.
So hard.
We are very hard on ourselves.
So hard,
okay?
yes. So, and I have, and it's worked. Like I have members who are like, wow, I didn't know I could get down here this easily. And we're on Crockett, so it's easy off and it's easy back on.
Yep.
And we have that parking right there. And actually the DDA worked with us, Cedric worked with the city and got some more parking opened up across. So we're right across from the old bus station.
Right.
And that was all red line, I guess, over there. It had been for years because of the bus station. You couldn't park, so they opened it up.
I hear the state is can go forward with the Wagner building.
Yep.
All right,
That
they're going
is
to go
true.
forward and finish that.
Yep.
Construction, so you'll have a whole new office, and all the state offices will be moving back downtown.
Right.
Okay.
So that's
which puts more people
exciting.
downtown, which
Yeah.
is really good.
It is.
Good for downtown.
It really is. It's really good. So we're excited.
Well, I love that you're doing this here, and it's a new idea even nationally.
Yes.
And it's another thing that can spin out of Shreveport, which we're always cheering for.
Right.
So
Yeah.
anything we can
I'm
ever
excited.
do,
Thank
we're
you.
cheering for you.
Yeah.
We love it.
I found a guy that owns a similar model in Tennessee, and I had reached out to him. I heard him on a podcast.
Cool.
I was driving to the beach a couple weeks ago and heard him. And I was like, I got to reach out to him, and so I did. And he immediately emailed me back, and he was like, I haven't heard of anybody with the same model since I opened in 2015.
How cool.
He was like, you're the first one that I've heard that's doing this. And so we kind of
And
connected.
you're right. I mean, the concierge medicine thing's on fire.
Yes.
The
Yeah.
whole longevity, all that part is on fire.
Medicine,
I
I think it really goes to medicine 3.0 now,
Yeah.
where people are taking charge of their medical care, and you're now managing your health care to live longer.
Yes.
All right?
Yeah.
So the longer you stay out of the hospital, the better off
You have
you
a
are.
lot of people taking a lot of medicine preventative
and-
stuff now too.
And
like-
honestly, from my perspective, like if you're a member, like I'm not making money selling the drugs.
right.
Like if I can get you off of a drug, even better. Like most pharmacies can't say that.
Yeah.
Like,
that's a great point.
I mean, I'm
I
charging.
got one for you. When we finish here, I'll throw out one.
Yeah.
But yeah,
Okay?
like I'm not.
You might pick up 5 or 6 customers.
Yeah, right here out of this group.
We're
you know?
in the
Yeah.
healthcare business, and it's not. I sell medications to help people, but I don't need to sell you medicines in my model to
That's
make.
awesome.
I just need to sell memberships and get people in the
Well,
door.
I hope you're on to the next
Yeah,
big thing. It
absolutely.
sounds like it is to me.
I hope
Yeah,
so.
this has been
We're
really
excited.
good. And I know you've been
Yeah.
to EAP. We've talked to you before, and, this is really exciting. And a lot of people don't realize that, hey, you can build the business in Shreveport.
Yes.
You can do it.
We're trying.
That's awesome.
We are.
Thank you, Heidi. This
Thank
has
you.
been
Heidi.
I
Thank you
appreciate
so
it.
much.
awesome.
Enjoy the podcast? We would love your feedback about today's show and who you think should be our next guest. Send us an email at info@eapla.com. Also, be sure to share the show and leave a comment on our social media post.